All right, and we also have a graduate from our bachelor's program as well as from our master's program with us today. So really pleased that they could join us, and they'll be sharing a little bit more about their experience in the program here in just a few minutes. The way we've set up the program today is to give you an overview of our programs and just briefly touch on some highlights about how the program is structured, what kinds of supports we offer to students, and how we work in this online environment with these programs. And then we'll be going into a little bit more about what's involved in the curriculum for each program, bachelor's and master's, and hearing from our two graduates about especially their field experience and capstone projects that they did. And that is something that is an integral part of the curriculum for our programs. So I'm hoping that you'll be able to take away some important nuggets of information that are really at a high level for the program. And it will spur you to want to look closer at what's required to apply, be admitted, and pursue these degrees after today. So I'm going to we'll have about 10 or 15 minutes here just starting out to go through some highlights of the programs. We should be able to wrap up our prepared remarks by about 12:35 or 12:40, and then we'll open it up for questions. And we'll use the chat feature here in WebEx to take your questions. Although if we need to, we can also have people unmute and we can have some interchange that way as well. So both of the health and wellness management programs really take a very multidisciplinary and holistic approach to health and wellness management. Our programs are designed to provide knowledge and skills in areas that equip our students to work in workplace population health. So that's all about managing maybe an employee population, employees and families. Some students go into a community setting, but it's really about working at that management level with a population on all aspects of health. So we don't just focus on physical, but we really provide coursework and knowledge and skills that relate to all these different dimensions of health. Here we have 7 dimensions. I know there's different models that some have more, some have less, but really it's a holistic kind of approach to give you a broad spectrum of knowledge that covers all of these across the gamut. Now, very often, and some of you might be familiar with the fact that health and well-being is often a component of benefit programs for many corporations and organizations. So we do find some students that come from that background and some graduates that go into that kind of work. So in addition to positions as things like wellness program manager or wellness coordinator, sometimes these jobs are embedded in benefits or HR function as well. So just a little bit about the bachelor's program in particular. In this case, a field experience project is required for graduation in the program. And the projects really vary widely from one student to another. But essentially, they all need to focus on some areas like what you see here: planning, development, facilitation, presenting within the context of a health and wellness program. Marketing and promotions is a very big focus often and a big component of fieldwork projects. And we also really work with students and encourage them to develop their professional network. This, I think, is a key component that we hope that students take with them and continue to develop as a lifelong kind of effort. I would also note that our programs are accredited through both UW Board of Regents and through the Higher Learning Commission as well. Now in the master's program, we have a capstone that really is the culmination of all the coursework that applies in the program. And this is a graphic that's actually taken from one of our courses, the capstone course itself. But it's such a great illustration of how the coursework builds on itself as you progress through the program. And really, when you get to that capstone, it's kind of like you're at the peak of the mountain. You've reached the summit. You're able to pull everything together and apply it in a capstone project that you design with support from our instructors and your academic advisors. A little bit about how the program is structured. This is a collaborative model, which is unique, I think, in higher ed. Because we have schools throughout the UW system in Wisconsin, we've been able to build this kind of collaborative model for health and wellness management along with several other degree options. In our case, for this program, we partner with the 6 campuses that you see on the slide here. And between these 6 campuses, we offer both the bachelor's and the master's program. UW Extended Campus serves as the administrative partner. That's why we're kind of in the middle. We're sort of the hub for this degree, providing resources both to campuses and to students. But the campuses really are able to focus on the academic piece of offering these degrees, which is the strength of our campuses. And so they create and manage the curriculum and the faculty and all of what goes into the degree program itself that students receive. Students do select one of the campuses to be their home campus when they apply to the program, and that is ultimately then where they receive their degree. But regardless of which campus a student is enrolled at, the coursework and curriculum is the same for everyone. Now, I want to highlight one particular aspect of the extended campus role and a component of the collaborative model, and that is a student success coach who's housed at UW Extended Campus, part of a team of student success coaches who support our students in a unique way. And I think this is something that is particularly valuable in our model that really serves adult students so well. And that's something I think that many other programs are able to offer. We have that support through Kaya, who's pictured here. She's the dedicated success coach for HWM. But we have a team that she is a part of. And if at any point she's not available, there's always someone available who's there to back her up. So this service is available to our students from the time they're admitted to the program all the way through to graduation and even beyond if needed. We do have tech support also available through Extended Campus. And another unique aspect is a student lounge that's part of the learning management system. We use Canvas for the program. And that's a component within Canvas that is accessible only to students. And we use that to provide students a way to connect with each other in a confidential course, and also to have access to resources. For example, this morning I offered some information that Kaya posted about an upcoming conference that students might want to attend. Sometimes there are job postings that we put out there, or just other general resources, current events kinds of things that come up. And our programs are 100% online, and they're asynchronous. So what does that mean? Essentially, you never have to be in the course or online at any particular time. So you really can fit this coursework into your own life and into your schedule as it fits. Now, that doesn't mean that it's self-paced entirely, because there are deadlines and due dates that apply for all students in each course. So there are quizzes on certain dates, there are assignments due at certain times. For example, a discussion post might be due on Friday, and everyone has to do it by that time, but you can decide when it fits into your schedule to actually do that post. So that's what we mean by asynchronous. And also, I want to just emphasize that these programs have always been 100% online. They're designed to be online from the beginning and really maximize the use of technology to make for a media-rich kind of experience for students. This isn't a situation where we transition to online in the last year, as many programs have to do, but this is the space that we've always been in and really have excelled in. So now just to share a little bit more about our curriculum itself, I'm going to turn it over to Jody to just give some highlights.
Sure. Thanks, Theresa. So as you can see on the slide, I think one of the unique aspects of this program is in one major, in one degree, you combine health and wellness information and content, as well as management content. And that's really unique. In a lot of situations, if this was something you were interested in, you would need a health or wellness degree and maybe a minor in something else or a double major. This major pulls everything together. And so you can see when you look through the courses under the health and wellness, we're going to give you really good general background on some of the issues that might be impacting our health and our wellness. We're going to get into some of the dimensions, some of them more specifically. You can see there are courses outlined for that. Help you to understand that behavior change process and real life applications to that. How do we, what strategies might we use for some of those behavior change? But then we also pull in some of that management content. So how do you understand a leadership style and an effective leadership style, how we communicate with others? How do we create those wellness teams? How do we create that supportive environment? So it's really this amazing blend of those two content areas. And then I think we can't overlook the fact that it also helps us figure out how do we navigate just the plethora of health information that we are constantly bombarded with. And when you're in this field, it's important that you can kind of sift through some of that. And so really the focus in this program is on kind of learning the assessment and the programming and the evaluation of the wellness that might be happening within an organization. And so sometimes we see students that go out and they become practitioners because they've gained those skills. This program is really designed to help you go out and gain one of those management positions, but you have to understand, what does the programming look like? What type of assessments are appropriate? How do we evaluate so that you can manage that team and you can help facilitate that process? And so it really is designed for you to come into a management position. And then we have our field work and our capstone. And in our bachelor's program, the capstone is more of a case study where you can apply all of the components of the program, because we know in getting out into a field work, some applied situation, you might not be able to utilize all of the content that's covered in the courses. So we want to make sure that you have that opportunity to apply it both in a real life setting as well as in a more broad setting with all the content that's been covered. And so Theresa, if you want to go on to the next slide, I can talk a little bit more about that field work piece. Yeah, so within the bachelor's program, our fieldwork experience is designed for students to get out and actually interact with people, apply the things that you've learned, use it. It's important for us that you know the knowledge, but we also want you to be able to utilize that knowledge and go through a situation where you're taking the content that's covered in the class and looking, well, how does this really fit in a real life situation? And so that truly can be from any of the areas within the content. I would say most often we see people coming into it kind of in the program planning implementation piece. But again, that doesn't have to be the component that gets applied. And so we might see, as Theresa alluded to earlier, program planning or implementation that is targeted at a different population. So it might be a program that's addressing some youth issues, or we might be looking at employee health, or it might be cardiac rehabilitation or law enforcement, or individuals that are in a group home that have special needs. So you're looking at what kind of wellness programming could I provide for individuals in these different settings. And again, this is a real life field experience where you are on the ground engaging with those individuals.
All right, thank you, Jody.
Mm-hmm.
So at this point, I'm really excited to introduce Pamela Murray. She is our bachelor's graduate who's going to share a little bit about the field experience project that she did. And she was in this situation when the pandemic hit. So she can share a little bit about how that impacted her project and how the program was able to support some changes I think she had to make in fulfilling the requirements. So Pamela, do you want to just tell us a little bit about yourself?
Sure. Hi, everyone. Thank you guys for having me. So yes, I graduated just recently in May of 2020. And like Theresa said, had to do my fieldwork experience during COVID. So it was definitely a challenge, but it ended up being a good challenge. So yes, I currently work in the nonprofit sector and decided to go back and get my bachelor's a few years ago. just for my own peace of mind, and then obviously to fuel my career and passion in the wellness field. So I currently work for a nonprofit in Lincoln, Nebraska, and finding the online program was ideal for me. Obviously, I was still working full time and raising a family, so I was able to complete the bachelor degree online, and it worked out just really well with my schedule. So yes, I work for Partnership for Healthy Lincoln. We're located in Lincoln, Nebraska, as I said, and I am the Wellness Programs Manager. So I oversee school wellness initiatives in our city. We are a 501c3 nonprofit, so we provide community wellness resources and programs. A lot of our work is serving low-income youth and families in medically underserved areas, so providing the youth, the staff that are working with the youth and their families with wellness resources and programs. What we kind of provide is funding opportunities and training. We implement cooking courses, physical activity clubs, gardening and farm to school initiatives, and partner with other nonprofits to push out wellness. And so I was able to do a really great fieldwork experience with our actual parochial side of our school system. So not necessarily the school system that I currently work with, but our faith-based schools had reached out as well for a new kind of program. So I do feel lucky in that I was approached a few months before signing up for my fieldwork experience to do some of that work. And so it just kind of happened that we had that community partnership already. So what we provided for the fieldwork experience was, again, a lot of wellness resources for those different schools. So I worked with 4 different individual schools and really partnered with their principals, their staff, and their teachers. So obviously during COVID, everyone was really concerned about wellness and how they could stay healthy. So again, just providing staff with wellness resources, whether that be mindfulness, physical activity, healthy eating habits. And then we also designed resources for youth in the classroom, and then also resources and materials for parents to do at home. A lot of our programming had to be done virtually, so through Zoom, recording videos due to the pandemic, and then also just pushing out newsletters, email blasts, and things like that, and doing some social media work as well. What else can I tell you guys? Here's more about the program. So obviously we had 400 parochial schools. We served roughly 400 staff and students, again, providing wellness resources. Again, I pulled a lot of our resources that we learned about throughout the course of our work, which was really helpful. We trained staff on various curriculums throughout the school system as well. Each week we had a wellness theme so that everyone would be in alignment with what was going on during that week. And we also worked with the principals to align these goals with their current school wellness policies. And then again, resources were given to families to do at home during the pandemic. So, you know, a lot of families could not go out and do things at their local gym or the sporting events that were normally happening. So we really wanted to make sure that we kept families active and healthy during the pandemic. So just providing them with resources to do at home or in the community. Anything else from me, you guys? It was a lovely experience. I'm so thankful for the experience. Again, it was different than we had anticipated, but I really worked with my instructors and with Dr. Shaban just to kind of formulate how the field work would go during the pandemic.
Yeah, that sounds great. Thank you, Pamela. I was
Sure.
just kind of searching for my unmute there. All right. Well, let's switch gears now to talk a little bit about our master's degree curriculum. And I'm going to hand it back over to Jody to just share a little bit about curriculum for that degree.
Sure. Thanks, Theresa. So the master's curriculum is 36 credits. It's 11 courses, and then the capstone experience, which you'll get to hear a little bit about in a few minutes. When we look at the curriculum for the master's program, I would say it has more of an organizational focus than what we see in the bachelor's program. So you're going to learn about things, creating strategic business plans, identifying specific strategies that might make you capable of addressing wellness challenges that a particular organization might face. There's going to be more discussion about all of the stakeholders that are involved and trying to help you get the communication skills and kind of that marketing side to promote the campaigns that you might have within your organization. Certainly within an organization, you have to look at what are some of the health policies that you have or the health systems that are in place, and how does that impact how you can go about designing or financing perhaps a wellness program. We also spend some time looking at, what do we see in this group of individuals within this organization? Why do they behave the way they do in this particular setting? And how do we go about trying to improve their behavior? How do we try to, their wellness behavior? How do we try to improve, the effectiveness and the efficiency of our organization in this particular setting? But that's not to say that we still don't need to develop some of the knowledge on kind of general wellness topics and emerging issues, because we know that people come to our master's program from a variety of bachelor's degrees. And so, that content is still built in within this program. And then just like our bachelor's program, kind of the culminating experience is that capstone experience. And so, again, very multidisciplinary in the curriculum. We're looking at wellness content, but now we have a little bit more of an organizational focus. Again, it's a health and wellness management degree. So now you're up more at that strategic plan and how do we assess what's happening within our organization as a whole, and how can this become part of what our organization or our company embodies and embraces. And so it's a little bit broader perspective from that organizational standpoint. And yeah, Theresa, if you want to go to the next slide, I can talk a little bit about our master's capstone. And so you'll notice right here on the slide, students identify an organizational need. So it comes back to that organizational focus. So what is a need that this particular organization has? And we're going to assess and analyze the data and then provide some recommendations or some programming options or those kinds of things. And so, again, examples, and you can see here project sites. There are a variety. A couple just to highlight. I know we've had a couple in school districts where the need that they identified was we need to reduce underage drinking. And that's because they wanted to improve the overall wellness of their particular community. Or looking at law enforcement, and another project looked at construction workers, and the need they identified was trying to create a culture of wellness within that setting. A company that has multiple locations, and so the need that they identified was we need to have environmental supports and communications in place to try to improve employee wellness, but how do we do that across multiple locations? So you can see with the Master's Capstone project, it's really about working within an organization and identifying a need specific to that organization, and then proceeding with the project.
All right, thank you, Jody. So now I'm excited to introduce Michelle, who is a graduate of our master's program, who's going to talk a little bit more about her experience with the program and especially the capstone project that she pursued. So Michelle, while you get started, I'm going to bring up your slides.
Okay, wonderful. Hi, everyone, and thanks so much for joining us today. I'm Michelle Repp, as Theresa said, and I pursued enrollment in UW's master's program, Health and Wellness, to help respond to the health equity needs of the food shelf patrons that I serve in Mound, Minnesota. And I appreciate the opportunity today to give you an overview of my capstone project, which I completed in April 2020.
Okay.
So will you move through my slides for me? Okay,
yeah,
perfect.
I think I'm going to have to, yep. Okay.
Okay, I didn't know if you could share it or not. All right. Well, the purpose of my capstone was identifying opportunities to advance health and wellness equity for Westonka food shelf patrons. And the project seeks to identify existing wellness resources to better support patron health through improved health literacy. I'd like to begin by briefly discussing the definitions of health literacy and health equity. According to the U.S. Department you can go on, Theresa. According to the U.S. Department of Health and Human Services, health literacy is defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information to make appropriate health decisions. The term health equity has a variety of definitions. One of the more commonly used definitions is the CDC version, and that is the opportunity for all people to attain their full health potential, and no one is disadvantaged from achieving this potential because of social position or socially determined circumstances. So in simple terms, health equity refers to everyone having the opportunity to be healthy in the places they live, learn, work, and play. This is a topic that I'm so passionate about because the gaps in our nation are significant, and unfortunately, they are continuing to expand. The foundation of this project is based on the assumption that we all have the responsibility to ensure that every member in our community has an opportunity, an equal opportunity, to be healthy and well. The mission of the Westonka Food Shelf is to reduce hunger in our local community by respectfully providing nutritionally balanced food options to those in need. It's an all-volunteer organization that operates rent-free in a beautiful new building. In 2020, we distributed more than 822,000 pounds of food to over 1,800 unique families, which is more than 4,600 unique individuals. And these patrons are all at or below 200% federal poverty level. We have been advocating for health equity for our patrons through our participation in the Super Shelf program, in which we make a commitment to procure and nudge patrons towards nutritious, healthy food choices. However, despite these significant efforts, our patrons, like people facing food insecurity across our nation, continue to face chronic illness at disproportionately high rates. We can confirm this evidence-based information through research and even surveys from our own patrons. And it highlights the health and wellness promotion need in this particular community that might not otherwise have access. Data from the U.S. Economic Research Service branch of the USDA indicates that chronic conditions in adults facing food insecurity are 18% higher than those in food secure households. Therefore, it's imperative to understand how to support overall literacy and wellness for these people. The Robert Wood Johnson Foundation, a thought leader on health equity and community culture of health, tells us that to improve communities, it's necessary to actively engage those most affected by disparities in the identification, design, implementation, and evaluation of promising solutions. And therefore, this project is driven by an assessment of our patrons in order to comprehensively understand their needs, their perceptions, and their interests. The driving questions that serve to focus this project include: how can we assess patron interest in gaining greater access to health and wellness promotion programming, and what wellness resources beyond nutrition exist that can be applied to a community food shelf to better support patron wellness literacy? There are a variety of health and wellness resources that managers can use to help understand the demographics of a particular community. I referred to many of these for this project, including county health rankings and roadmaps, Feeding America's Mind the Meal Gap, Hennepin County SHAPE 2018 survey, Hunger Solutions results, and many community health assessments. The Westonka area we serve has a largely Caucasian population with a primary care ratio of 846:1. That's significantly better than the state average. Additionally, the median household income in the area is $8,200, while qualifying patron family of 4 has an income at or below $52,400. Interestingly, the Hennepin County SHAPE survey revealed that approximately 50% of individuals that lived in this particular area were worried that they would run out of food before they had money to buy more. This is the classic test for food insecurity, so it shows that the need is great. When planning a health and wellness intervention, our classes teach us that those grounded in theory are more effective. One of the most effective theories to consider is the social ecological model, and that starts with the individual and expands out through the interpersonal, organizational, community, and public policy levels. And these levels of influence were considered as a guiding resource in this project. HWM classes teach about the many best practice resources that are available for evidence-based direction and planning community interventions. One of the best models is the Robert Wood Johnson Foundation Culture of Health framework. And it's used to develop communities that make health a priority. The framework focuses on collaborations to make that possible, and we've expanded on that concept in this project. And other important resources used for this include Healthy Minnesota 2022 and Healthy People 2020, which is now Healthy People 2030. Gaining patron insight was the first need in this project. It was determined an on-site survey would yield the best response rate. So our volunteers provided pen and paper survey to patrons who entered the West Tonka Food Shelf during a 3-week period for the purpose of gaining insight into their literacy and interest in health and wellness programming. The assessment strategy considered planning, design, implementation, and development. And survey development tools were used from Walcoa, Qualtrics, the U.S. Air Force, and other community health assessments to determine the best questions for this survey. The data provides information accessing health literacy, health conditions, interest in pursuing lifestyles, barriers to participation, and programming topics of the most interest to our patrons. The results indicated that nearly, you can slip ahead 2 more, Theresa. The results indicated that nearly all respondents knew there was a strong link between the foods that we eat, levels of physical activity, and overall health. And this awareness is a good indication that patrons have health literacy skills and the ability to understand what needs to be done to make health-related decisions. Almost 3/4 of patrons reported one or more chronic disease, with just slightly less than half reporting anxiety or depression. 1/3 of our patrons responded that they had high blood pressure, compared to an average of 22% in the West Tonka area. And other notable deviations included nearly 1/4 of our patrons responded to having diabetes, while only 6% in the general area do. 44% have anxiety or depression, while less than 1/10 of those in the Hennepin County survey were at risk for it. So slightly under half of the WFS patrons reported using tobacco within the past 12 months, whereas only 6% of individuals in the Hennepin County area report using it. And of the patrons that are reporting tobacco use, more than 1/4 were interested in cessation resources. And this is encouraging because it reflects their desire to quit and utilize resources that might be helpful to them in doing so. The Minnesota Quit program is a free resource we can refer patrons to as a partner in their cessation efforts. 86% of our patrons indicate that they are on the continuum of a healthy lifestyle and that they're interested in learning more about wellness topics. This is another important statistic indicating they're interested and receptive to health and wellness promotion. Patrons cited that frequently cost is their biggest barrier to participating in healthy activities. Further, like the rest of us, they identified lack of time and other responsibilities as barriers. Finally, the survey asked patrons what specific topics they're most interested in. And between nearly 1/3 and half of all respondents indicated that they're interested in healthy eating, stress management strategies, physical activity and exercise, sleep improvement, healthy cooking classes, mindfulness and gratitude, and walking programs. Knowing what they're looking for aids in our ability to be able to advocate for their programming needs and desires within our community. This project essentially serves as a starting point for the much bigger project of improving patron health equity. However, the important groundwork has been laid for the project to move ahead. HWM 750 provided me with the opportunity to develop a detailed execution plan, and this project is well underway as we're currently seeking a grant from our community to implement this project. I'm very excited to use my new skills that I developed in UW's Health and Wellness Master's program to make meaningful changes in health equity in my community. Thank you for your time today and your interest in learning more about UW's program. I've appreciated the opportunity to share with you the fruits of my learning experience.
Hey, thank you so much, Michelle.
Thank you.
Yeah, this is just an excellent example of really a project that came together over the course of working through the program. And we do have students that come in knowing exactly what they want to do as they get to that capstone experience, but many, if not most, are really figuring it out as they work through. And we have supports available and resources to help identify organizations and really to build on that project. So I'm going to switch us back to my slides. Here we go. So as we're kind of wrapping up, I thought, just a few notes for you for those who are looking at applying for the program. What does that entail? First, I want everyone to know that you can start the program during any semester. We do run on a traditional semester schedule, but you can start coursework in the spring, the summer, or the fall. Those are all options that are available. The one guideline that I do want to stress is that it's best to begin the application process at least a month before the semester starts. It does take some time to submit the application and the materials that need to go with that, for it to be reviewed at the campus, and then for students to be admitted, and then to get registered for courses. Also, we have a what we call preview week. So the week prior to the semester start, courses are open for students to log in and see firsthand what the courses that they've registered for, what they look like, and what's going to be expected of them. So that's a really helpful advantage as well. So next steps would involve, and I do want to encourage you, if you're first looking at the program, to schedule some time to meet with one of our enrollment advisors. Some time on the phone with one of them can really be helpful in addressing any questions that you have related to the process, the program itself, really anything and everything that might be on your mind related to pursuing one of these credentials. There's an online application, of course, then for University of Wisconsin system. We use that system application. Currently, there is no application fee for the bachelor's program, except at UW La Crosse, and then it's $25. And for the master's program, there's an application fee of $56. And then just a couple more steps, and I do want to mention too that there are program course prerequisites for both bachelor's and master's. There are 4 prerequisite courses that you'll need to take. If ideally, it's best to have those completed before you begin HWM coursework, but sometimes we can have a transitional semester kind of to start where you may be completing prereqs and take maybe one of the HWM courses just to kind of get going down that road. Those courses are all listed on our website, along with all of the information that we're talking about today related to the program itself. So I encourage you to take a look at the hwm.wisconsin.edu website if you haven't yet. And with that, we can turn it over to questions. And again, I want to just thank everyone who's signed on today. We really appreciate that you've taken the time to join us, and really hope that this was helpful. So if you have a question either about the program or a question for Jody or for Pamela or Michelle, please feel free to put that in the chat. Or if you'd like to, if you're comfortable, if you'd like to unmute and ask your question, we can do that as well. So we'll just give it another minute or two and see if, oh, here we go. Here's our first question. What all is needed in the application process? So in applying for the program, now it will vary depending on if you're in the bachelor's program or the master's. So for the bachelor's program, it's that online application, and then any transcripts from colleges or universities that you've attended would need to be submitted for review. And I also should note it's a bachelor's completion degree, which means that you should have either an associate's degree or partial credit toward a bachelor's degree that would transfer in to satisfy general education requirements. And those GE requirements do vary a little bit from one campus partner to another. So it can, if you have questions about that, please contact an enrollment advisor for a call as a next step, but we're happy to work with you on answering questions related to those. The prerequisite courses for the bachelor's program are an introductory course in biology and psychology, and then also an intro to public speaking and an upper level writing course. Those are the 4 courses. And again, this is listed on our website under the Get Started heading. For the master's degree, we also look for an intro to psychology, and then either an intro to biology or an anatomy and physiology course, one or the other of those. And then personal health and an elementary statistics. So 4 prereqs for each program. So your transcripts that are submitted would be documentation of that coursework if you've done it. If you haven't, we can help you identify different options for completing that coursework online. And there are some very good options within the UW system even to complete those online.
And I guess I would just add to that, if you're looking at the master's program, sometimes it's better to complete those prereqs before you are admitted as a graduate student, because once you are admitted to the university as a graduate student, you pay graduate tuition. So you can be admitted as a special student first to complete some of those prereqs that you might have, and then begin the graduate status in the graduate program.
Great. Yep. Thanks, Jody. Yeah, and as I was talking with Michelle the other day, she shared that she was able to complete a prerequisite through our independent learning program, which is a self-paced option, and you can sign up at any time. There's no semester time frame to work within. And depending on the course, not all the prereqs are available through independent learning, but those that are, that can be a very convenient option. And then I see a next question has come up about when those prereq courses need to have been completed. We don't require them within a certain time frame. So if you completed your bachelor's degree 30 or even 40 years ago, and you are now applying for the master's degree, for example, or even the bachelor's, as long as you have a transcript to document that you took the course and what grade you received, that's all that's required. So no particular time frame.
Hi, can I ask a question really quick?
Yeah, please.
Hey, thanks. My name is Amy. I'm calling from San Francisco, California, and I'm interested in the master's program. And I'm actually wondering about the origin of the program in general. It is very unique, and I have been researching across the country. So I was just curious about how it came to be a program that was so well balanced. If there's a little explanation on that. Thank you.
All right, thank you, Amy. Yeah, that's a great question. I can offer a little bit, and Jody might want to add to it, but when the University of Wisconsin looks at offering a new program, they typically will start by doing some extensive market research to identify needs in the workforce. And essentially, that's kind of the seed where it starts. But then it becomes a process of bringing in the campuses who have expertise in the content areas that apply to a particular degree. And those campuses that sign on to a program then have the different curriculum areas that they can support through faculty and instruction to create those programs. So really it was a process of research through a research firm that UW enlists services, and then also meeting with industry professionals and doing some focus groups and bringing in, the people who are boots on the ground doing this kind of work now, and what do they see for needs in the workforce currently and then going forward as well.
Yeah, and I don't have anything to add. I was going to say it was really, in addition to the market research, it was really talking to those in the field and realizing that people either had the business knowledge or they had the wellness knowledge, but in many cases they needed both for the positions that they were applying for.
Great, thank you.
Okay, thanks. All right, is there anyone else? Oh, here's a question about starting the application process previously. So about 2 years ago, and then things happened, and we know life happens, pandemic or not. Can those transcripts and original application be pulled from again? I think that it might depend on the campus. The process might be a little bit different depending on which campus. But there is I would probably suggest contacting the campus that you had originally applied to. But Jody, you might have a few more tips on this one too.
Yeah, I would say I would reach out to the campus that you applied to. The rules are going to be different depending on the campus. For most campuses, if you weren't officially accepted, like if you were in the application process but you hadn't completed the process, and so it wasn't that you were accepted and you deferred or declined, they may still have some of that paperwork and you may be able to build on that. But if there's additional coursework that needs to go on a transcript or something like that, that would need to be resubmitted. If the transcripts have not changed, I think the transcripts can certainly be applied to your application. Again, that varies by campus, but if there hasn't been a change in the transcript, I think those should be able to be used.
Yeah, thanks you for that question. I think that came from Brady. It reminds me too of another strength of our programs is the flexibility in that students are able to progress through at their own pace. So you may take one course each semester and just keep plugging along at that rate, or some will take a full-time credit load. Some maybe don't have a job and want to really just devote their time to completing a degree. That's an option too, or it might vary from one semester to another. And some students will take a semester off and then come back to finish. So there's lots of different options for students to progress through. Your credits, as you earn them, they don't expire, so you can keep going at your own pace. Now at the graduate level, it might be like 5 years or something, depending on the campus, but at the there's a lot of leeway in how you, the pace at which you progress through the program.
Yeah, and most grad programs is 7 years.
Okay, thank you.
Mm-hmm.
And Theresa, can I just touch on that also? That was, for me, a highlight of this particular program. I graduated from college 30 years before, and I wasn't sure how going back to school was going to feel for me. And also, I travel significantly with my husband who travels for work. So a lot of times we're in Europe and on different time schedules and in different places. And I was always able to make this program not only work, but to really feel like a fully immersed participant in this program. So it really has tremendous flexibility for whatever your lifestyle is.
Oh, thank you, Michelle. Yeah, that's really good to know. And, for that reason too, we have students who are in the military, who are even, called up for duty, but are able to continue their studies from wherever they happen to be stationed. So there's lots of just being in this online format gives us a lot of advantages that way.
Yeah, and Jen, thank you for that comment. You're exactly right. So for the master's programs, there are time limits. Many, I'm at River Falls, 7 is ours. 7 is the traditional. There's definitely some flexibility, but for master's programs, there's always a time to completion. So there's a certain number of years before your credits no longer will be able to be applied and used.
Okay. I see there was a chat about time to completion for the masters in particular. It does vary a little bit by campus of how many years for graduate credits. All right, are there any other questions? We do have a few more minutes before 1 o'clock if anyone has anything on your mind. Any postmaster certificate option? In fact, we do have a new graduate certificate that is just rolling out. It is actually a combined certificate between health and wellness management and another collaborative degree program that Extended Campus offers in sustainable management. So in that case, we have 4 courses that are required for the certificate. 12 credits total. 2 of the courses are from health and wellness management, and 2 courses are from sustainable management. So we are, as I said, it's in the process of rolling out. By this fall, it will be available to students to enroll. So that is an option we can provide more information about. It hasn't fully launched in terms of posting on our website all of the details, but that is coming probably by later in the spring. It's called the Sustainability and Wellbeing Certificate. All right, so I just advanced to our final slide, which has contact information for follow-up. We will send out a recording of today's webinar for everyone who participated and for those who signed up but maybe couldn't join us or not for the whole time. So we'll have that available. I'm happy to address any questions that you might think of later on if something comes to mind. And we'll stay on for a couple more minutes if anyone has any other questions that they think of. Oh, you're welcome, Amy and Nicole. I hope this was helpful for everyone. And I do also want to thank Michelle and Pamela for sharing your stories about your projects. I think it's so important for those who are considering this degree to hear what it was really like from those who've been through it. And thank you, Jody, for joining us today to handle the academic side.
Yeah, my pleasure. Thanks for including me.
All right, well, I think we can wrap it up then. I don't see anything else coming in, and looks like people are wrapping up too. So
Bye, Pamela.
Thank you everyone very much.
Thanks, Michelle.
All right.
Bye-bye.
Take care.